My name is Cyrus Ghavam, and I'm an orthopedic spine surgeon with Pain Care Specialists of Oregon. I've been doing spine surgery for over 20 years. My approach to back surgery is using a multidisciplinary approach. We work with physical therapists, chiropractic care, acupuncture, massage, pain management, including injection therapy, and any other option the patients feel is reasonable and appropriate for them. There are two reasons that patients ultimately decide to have surgery. One of them is pain that they consider disabling. They can't function with their daily activities. They can't do their sports, they can't play with their children or grandchildren. The other one is a neurologic deficit. Patients who may have either significant numbness or weakness that limits their ability to do the things they want to do. And often it's one of these two things that has not responded to non-surgical care that makes us want to proceed with spine surgery. The approach that I've generally used is called shared decision making. And I find that my responsibility is to talk to the patient, advise them of their condition, discuss various options that there are for treatment of their condition. The times that we elect to proceed with surgery is when someone has pain that is so severe that they just can't manage day-to-day activities. And sometimes the pain isn't that severe, but it's just been going on for so long that every time they do something that they want to do, whether it's running or softball or golfing or even walking with their children, that the back pain and the leg pain are limiting their ability to do that. And they decide if there's something we can fix here, and if it hasn't responded to all the other measures, then surgery would be a reasonable option for them. A lot of times there's patients who have a neurologic deficit, and by that I mean a nerve damage that's occurred. Thankfully, in most cases, that is reversible. We can correct that by taking the pressure off the nerves. There are some types of nerve damage that are very disabling for patients. For instance, if someone has weakness of their shoulder muscle, they can't raise their arm and put their hand where it needs to be. Another one is weakness of the thigh muscles, the quadriceps, patients who may fall every time they go down a step because their leg just buckles. Those are conditions for which surgical treatment generally is reasonable sooner rather than later. There's other conditions in which patients have some achiness in their back, and this can, in most cases, be safely managed without surgery. We can manage that with physical therapy, injection therapy. The goal here is to restore them to their normal functional ability and use a microscope, a surgical microscope, to view the nerves and the discs with much greater clarity than would be feasible. That enables us to make smaller incisions, which typically means less pain, less bleeding, less hospital stay, and a shorter period of convalescence. Our patients can return to their activities much more quickly with less pain than they could in years past. Often patients will wake up right after surgery and the pain that they had going down their arm or down their leg from a pinched nerve has resolved. A lot of times I see patients for whom surgery just is not the best choice, and I can advise them of that with a face-to-face meeting, an examination, and review of their imaging studies, which means their CAT scan, X-rays, and MRI. I often consult with my colleagues in the Pain Care Center who have a different approach of using injection therapy or spinal cord stimulation, and we decide, is this the best option for the patient or should we choose another option? I think having different providers with different backgrounds offers more of a complete option for patients who have back problems. Not all patients are the same and not all their conditions are the same, and we like to really customize the treatment to each patient. The greatest strength of working at Pain Care Specialists of Oregon is that we offer the whole spectrum of care.